This image gives a brilliant visual summary. Now let us now transform it into a clinical superpower. So for example, a young male with no symptoms found HbSAg positive in OPD labs. So you think hepatitis B carrier. And now if patient presents for unrelated cause, for example pre-employment or pre-op, and HbSAg is positive, then you should ask what is the ALT trend, what is HbEAg status, what is HBV DNA, and liver elastography, fibroscan, family history of liver disease or HCC. These things should come to your mind. So what about this HBV screening panel? We know that HbSAg, what it tells you is infection. It can be acute or it can be chronic. But if anti-HbC IgM is positive, then it means acute infection. And if anti-HbC IgG is positive, then it means past or chronic infection. And HbEAg means high infectivity, and this HBV DNA, it shows us viral replication. It is used for treatment decisions. Now let's decode everything. On the left hand side you can see asymptomatic, which are mostly seen. These the natural history in hepatitis B viruses. Patients will be mostly asymptomatic, 75 to 80%, and so interpretation is most HBV infections are subclinical with no jaundice or no symptoms. And this is why HBV is a silent killer, because mostly people walk around undiagnosed for decades. And there can be recovery as well, 65 to 90%, and most people clear the virus spontaneously and no treatment required for these patients. So question is, what percentage of adults spontaneously clear acute hepatitis B virus? That is around 65 to 70%. Some say 65 to 90%. So you can answer it as 90%. Now there is another group, that is chronic HBV infection. So 5 to 10% develop chronic hepatitis B virus infection. So risk depends on age at infection. So neonates or perinatal age, in that case 90% will progress to chronic hepatitis infection, and in adults only few. So chronic HBV, so if we see the disease spectrum, there can be spontaneous clearance, that is 1% per year, which is rare, and the patient can have chronic hepatitis, where you will see raised ALT, fibrosis risk. Third, you can see patients having cirrhosis. Fourth, HCC plus minus cirrhosis. So this is spectrum. So chronic HBV infection doesn't remain chronic. It can lie on this spectrum, where patients can have HCC or patients can have cirrhosis. Even HCC patients can or cannot have this cirrhosis, or patients can simply be having chronic hepatitis picture, or patient can, even in chronic HBV patients, there is 1% recovery, spontaneous clearance. So HCC may occur without cirrhosis due to the HBX gene, that's oncogene present in them. So spontaneous clearance, chronic hepatitis, cirrhosis, and HCC with or without cirrhosis, and treatment based on indications. And treatment is based on ALT, HBV DNA, fibrosis, HbEAg. So what treatment do we use? We use tenofovir or entecavir, and we don't give PEG IFN, that's pegylated interferon, if patients are in cirrhotic stage, if patient have autoimmune disease, if patient have HIV co-infection, or if patients are pregnant. So pegylated interferon have 4 contraindications. One is cirrhotic, autoimmune disease, HIV, and pregnant females. On the right hand side you will see symptomatic patients, that is 20 to 25% of the cases, these patients have acute hepatitis with jaundice, but it's clinically indistinguishable from other causes. So they simply land up in acute hepatitis. They will come to you in jaundice, and so at this point of time you have to do HAV, HEV, HB, SAG, everything you have to do, because it's clinically indistinguishable from other causes. Patient will be presenting in jaundice. So what is the outcome? 90 greater than 99% will recover, less than 1% will develop ALF. So treatment is supportive unless ALF, and if ALF, then start antivirals like tenofovir or entecavir. So acute hepatitis B, no antivirals, but in ALF or immunosuppression give TDF and entecavir. Otherwise you don't treat these cases with TDF or entecavir. There are only two indications. One is a patient is an ALF or a patient is immunocompromised. So these are the two indications. So bottom line, if we see, as per Baltimore classification, class 7 virus, this is HBV is partially double-stranded DNA virus with a reverse transcriptase activity that is unique among DNA viruses, as per this HBV class 7. So these ORF, one is this ORFP, ORFS, ORFC and ORFX. This is the genome, and ORF is open reading frames. ORFP produces polymerases, and this produces surface antigen, this produces core and E antigen and this produces X antigen. And what is the clinical relevance? ORFP, it is a drug target of tenofovir, and entecavir blocks this. So it is the drug target. Tenofovir and entecavir block it. Whereas surface antigen, this is the diagnostic marker plus vaccine target. Third is ORFC, it is core antibody, means past infection. E antigen means replication. So core antigen means past infection, E antigen means replication. Whereas ORFX, that is transcription activator, that is the oncogene that causes HCC risk. So there is a mnemonic PSCX, polymerase, surface antigen, core antigen, X means cancer. Now less than 1% develop ALF, which is a very rare complication. It's associated with fulminant hepatitis B, tenofovir, entecavir. If ALF or if patient in immunocompromised, these drugs decrease risk of progression and mortality in ALF. And Harrison 22nd plus AASLT recommend antiviral initiation if ALF suspected. C means core. So core antigen is not detectable in serum, but core antibody is. So this core protein, whenever it is seen in serum, you have to think that it is a past infection. And HBsAg positive plus normal ALT plus high HBV DNA means patient is in immune tolerant phase, so don't treat yet, monitor. And note that HBV is not a virus, it is a pathway to liver cancer that starts silently. So screen wisely, monitor deeply, treat timely, think in phases, not snapshots. And as per Harrison 22nd edition NEJM AASLD, key points are HBV integrates into genome, increases risk of HCC, and HBX is the key player in hepatocarcinogenesis. Tenofovir and entecavir are safe, potent and have no resistance over long term. Thanks, and subscribe.